Hello and welcome to my channel Easy and Different Radiology. I am Dr. Osama Ibrahim, consultant radiologist, and today our appointment number 22 in tips and hints. In this presentation today, I'm gonna talk about the TI RADS, and if you look at these different imaging of the thyroid nodules, you can consider it as pretty similar. However, it's really different, and according its possibility of malignancy or suspected to be malignant, the TI RADS can classify them and make scoring. And this is the main talk or main issue of my presentation today. So let's start our presentation. The learning objectives from my presentation today is how to discriminate the ultrasound findings for each TI RADS score. And the TI RADS scores are 5 scores, starting from TI RADS 1, TI RADS 2, TI RADS 3, TI RADS 4, and TI RADS 5. And this is the final conclusion if you make classifications of the TI RADS according to the ultrasound image. You should reaching to one from these 5 TI RADS, and through my presentations you can understand step by step how can each one discriminating do. First of all, what is the definition of ACR TI RADS? ACR is the American College of Radiology. TI is from thyroid imaging, RADS is reporting and data system. So ACR TI RADS is representing American College of Radiology, thyroid imaging, radiology reporting and data systems. ACR TI RADS scoring is determined from 5 categories of ultrasound finding. These categories, according to the finding in each category, these 5 categories, I can reach for the final scoring of TI RADS. The first one is the composition, the echogenicity, shape, margins, and echogenic foci presence, and what is the description of these foci. So this is the main 5 categories which according to them can categorize or can scoring, and after scoring each one I submit them and making a scoring for the TI RADS. This is a summarization of my presentation today. However, what about the details? The details, just pay close attention to the general rules that I'll teach you during these lessons, and I will reaching to how can make this score. Let's starting by the first category, which is the composition. The compositions, according to the compositions of the nodules in the thyroid gland, if it is cystic, it takes score 0, spongy form takes score 0, mixed cystic and solid take score 1, and if it is solid it takes score 2. TI RAD 1 benign, no further characterizations. If the nodules is cystic or spongy form, no need to complete the TI RADS, and it considers as a benign directly. Let's see this is in the image, the composition in the image in different thyroid nodules with different TI RADS. First one is solid nodules. There are no cystic components, so it is solid, and it takes score 2 according to the TI RADS from the composition. The other one have part cystic and part solid. However, the part of cystic is very small, tiny in this large solid component, so it considered also solid and take a score 2. However, this one is have partly cystic, partly solid, so in the composition score it considers as a mixed cystic and solid and take score 1. This one, which is completely cystic, so this one is called cystic nodules, and the cystic nodules take score 0 and considers as a normal thyroid TI RADS. No need to complete the TI RADS if the nodules is cystic like this. So during this image you can understand what is the meaning of compositions and how can make scoring of the composition. And this one is the spongy form compositions, which is representing nodules with multiple small cystic component which about more than 50% from the nodule or about 50%. So at that time I can describe it as a spongy form composition, and also the spongy form composition is considered as scored as a 0 score in TI RADS, and no need to complete the scoring if the nodule like this spongy form. Let us talk about the second category, which I making TI RADS according to them. This one is the echogenicity. Echogenicity is the echogenicity of the nodule if it is anechoic, take 0, which meaning cystic. Hyper or isoechoic take score 1. Hypoechoic take score 2. Very hypoechoic take score 3. Again, let us see this in the image of the echogenicity of different thyroid nodules. There are different thyroid nodules. This one, for example, is the hyperechoic nodules. As we see, it have an echogenicity higher than the echogenicity of the thyroid gland itself. So it takes score 1. However, this one is isoechoic. The nodules take same echogenicity of the thyroid nodule, so it takes score 1 also. Hyper or iso takes score 1. However, this nodule is slightly lower echogenicity than the thyroid nodule, so it takes score 2 as it is described as a hypoechoic nodule. This one is very hypoechoic nodule, they can take score 3. Like this nodules, which is very hypoechoic nodules comparing with the strap muscle which appeared here at anterior aspect of the film. So when the nodules have a very hypoechoic like this, it can described as very hypoechoic as an echogenicity and take score 3. Let us talk about the shape. Shape of the nodules, which meaning of shape, meaning the relations of the deepest part of the nodules, anteroposterior part from the transverse diameter. If it is taller than wide, it takes score 3. However, if it is wider than tall, it takes score 0, according to the shape category in the TI RADS. This measurement should be in the transverse position, not in the sagittal view of the thyroid gland. As we see here, this is the left lobe of the thyroid, and this is the trachea, and this is the isthmus, so this is the transverse positions. At that position, if the nodule is taking taller than wide like this nodules, I give it score 3 in the TI RADS. The margin is the fourth component or category which can adjusting the TI RADS or scoring it. And depending on the margins, there are smooth margin, take score 0, ill-defined margin. If there are ill-defined definitions of the margin of the nodules from the thyroid gland, it takes score 0 also. Lobulated margins or irregular margin, it takes score 2. Extra thyroid extensions which passing through the capsule, beyond the capsule, so at that time give it score 3. So this nodule is have smooth margin, so smooth margin takes score 0. The margin can be also seen in these images. As we see here, the margin is speculated and irregular, and at that time speculated margin or irregular margins, I can give it score 2. Can be described as a jagged margin also. However, these margins have lobulated outlines as we see here with that nodule. So lobulated margins is similar to the irregular speculated or jagged margins, and as according to the margin category, it takes score 2 also. So according to the margins, speculated, jagged, irregular, lobulated, all take score 2. The last items for categories which is can define the TI RADS is the echogenic foci. Echogenic foci meaning the calcifications in the thyroid gland. If there are no calcifications, or if there are comet tail calcification, comet tail, large comet tail, artifacts meaning calcifications more than 1 millimeter and have a tail or have a shadow, and this echogenic shadow is considered as a comet tail. At that time, I can classify it as a 0 or give it score 0. However, macro calcifications take score 1, which more than 1 millimeters. Peripheral rim calcification take score 2. Punctate echogenic calcifications, which have a diameter less than 1 millimeter, can take score 3. So according to the echogenicity 0, 1, 2, 3, according this description of the calcification. So in this one there are large comet tail calcification, so it will take score 0. And these different types of thyroid nodule which have calcifications, and according to the type of calcifications I can give it score according this echogenic foci, and this can helping or sharing in the TI RADS formation. For first one, there are multiple small calcifications less than 1 millimeter, and this is which is called micro calcifications or punctate calcification. According to the description of the punctate calcifications, it can take score 3. However, these nodules have calcifications which have posterior shadow, posterior black shadow, and these calcifications are more than 1 millimeter, so I consider it as a macroscopic calcification, and macroscopic calcification takes score 1 only. This one is easily to describe it as a rim calcifications, and the rim calcification or peripheral rim calcifications take score 2. If you notice there are interruptions of the calcification at that point, which confirmed also by Doppler study as tissue hair, or as a growth of the lesions or the nodules at that regions. So it takes score 2 to elevating the scoring of the TI RADS or possibility of malignancy. So peripheral rim calcifications, it takes score 2. However, if you look at this one, there are peripheral calcifications in this nodule, and so it takes score 2. This one have peripheral calcifications and have also internal calcification, and this calcification similar to that one have diameters less than 1 millimeter, so it considers as a microcalcification. So microcalcification upgrading the score from 2 to 3, so it will take score 3. So this is the echogenic foci. How can calculating the scoring of the echogenic foci to form the TI RADS at the end. ACR TI RADS calculations done by submissions of the all 5 categories, previous categories which I described. These categories is the compositions, take the score of compositions, echogenicity, shape, and for margins, number 5 is echogenic foci. After making a score of each one, summation of them making the TI RADS. Let us see this in the summarized diagram. The final scoring can calculating from the 5 categories. Compositions, if cystic or spongy form take score 0, mixed cystic and solid take 1 and solid take 2. Echogenicity, anechoic take 0, hyper or isoechoic take 1, hypoechoic take 2, very hypoechoic take 3. The shape, if wider than taller, take 0, taller than wider, which meaning depth is more than the transverse diameter, take score 3. The margin, smooth or ill-defined margin take 0, lobulated, irregular, jagged margins take score 2 or speculated margin. However, extra thyroid extensions take score 3. Echogenic foci, if there are no foci or there are large comet tail artifacts, taking 0. Macrocalcifications take 1. Peripheral rim calcification take 2. Punctate microcalcification less than 1 millimeter take score 3. So according to this scoring, you can submit all these score and make the final TI RADS. If the submissions is 0, TI RADS is considered 1. If 2, consider 2. If 3, consider 3. From 4 to 6 submissions is considered the TI RADS 4, and more than or equal 7 is considered TI RADS 5. Each one is representing the status of the nodules from benign, non-suspicious, mildly, moderate, or highly suspicious nodule, and the next step which we will do after that. This is the final scoring. However, in the next slides, I describe it again in the slightly slower way. So scoring and recommendations and risk of malignancy, I can describe it in this schedule. The scoring recommendations and risk of malignancy. If I describe it as a TI RAD 1, in which making a score is 0, summation of the score is 0, it considers as a benign nodule and no need for FNA. And the risk of malignancy in these situations is 0.3%. If it is TI RAD 2, this is if the score is 2 and this is not suspicious to be malignant, no need also for FNA. The possibility of malignancy or risk of malignancy is 1.5%. TI RAD 3, if the score is 3 and this is meaning mildly suspicious to be malignant, follow up if the nodule is more than 1.5 centimeters and the fine needle is recommended if the nodule is more than 2.5 centimeter and the possibility of malignancy or risk of malignancy 4.5% in this category of TI RADs. However, TI RAD 4, if the scoring is submissions 4 to 6, is considered moderately suspicious of malignancy. Follow-up is recommended if the nodule is more than 1 centimeter and FNA if the nodule is more than 1.5 centimeter. The risk of malignancy 9.1%. TI RAD 5, if the nodule is equal to or more than 7 as scoring, it is highly suspected to be malignant. Follow up if the nodule is more than 0.5 centimeters. However, if the nodule is more than 1 centimeter, the 5 needle aspiration cytology should be done, and the possibility of malignancy at that time 35%, or risk of malignancy is 35% in this category. And now let's practice with 4 cases and we try to do the TI RADs of them. So concentrate in this in the next slides, because I want to finish up today's lesson by this let's practice, which confirms the understanding of the video or the presentation. So the case 1 is this image of the nodules which have lobulated outline. So if you can do TI RADs to it, I can give you 10 seconds according to the 5 categories, give score and submit them and make the TI RADs. First of all, the compositions, as we see here, the compositions you have options, and the compositions here is solid, not cystic or partly cystic, so it will take score 2. The echogenicity, iso, hyper or hypoechoic or very hypoechoic. If you look to the nodule, it's similar to the thyroid or slightly darker than the thyroid gland. So if it is have part similar and part darker, consider it as a darker than the thyroid gland, and also an echogenicity considered take score 2 as a hypoechogenic. The shape, if the nodule is larger than taller, it will take score 3, as this nodule, if you look at that diameter, is more than the transverse diameter, and in this times you can consider as 3 in shape. The margin of the nodule, the margin is smooth, ill-defined or irregular, lobulated outlines or extra thyroid extension. So also if you look closely to that nodules, it have a lobulated outline margin. So at that time it will take score 2 as a margins. And the last category is the echogenic foci. If there are calcification, we can give that scores. There are no calcification, so it will take 0 score. After that you can submit 2 plus 2 equal 4 plus 3 equal 7 plus 2 equal 9. So the final score of this TI RADs is 9, and the TI RADs, as we know, if it is 7 or more, it considers as a TI RAD 5. TI RAD 5 meaning the highly suspected to be malignant. So this nodule, if you wanted to recommendations for what we'll do later, follow up if the nodule is more than 0.5 centimeter. However, this nodule is larger than that. So if the nodule is larger than 1 centimeter, it should be done fine needle aspiration, and this is the recommendation in this situation. This is the way how can you describe or how can you scoring the TI RADS for the thyroid nodule. Still we have another 3 cases more. You can do it yourself. Let us changing to the next slide. Case 2, this nodule, you can describe it according to the 5 category. I will give you 10 seconds. After 10 seconds, do TI RADS and give the recommendation. If we're starting with composition meaning cystic, mixed cystic, solid or solid. This nodule is solid, so it will take score 2. And also the echogenicity, if you look at that echogenicity compared with the thyroid tissue, it is more darker than it, so it will take 2 also as a hypoechoic. And the shape, there are no dips more than the wide, so at that time it takes 0 as a shape. The margin of the nodule is a smooth margin, so it will take 0 also due to a smooth margin. And the presence of calcifications, echogenic foci, there are no echogenic foci, which meaning it takes 0 also. If you make summations of the 5 categories, 2 plus 2 equal 4, so the final score is 4. 4 meaning the TI RADS is also 4, because the 4 is if the score between 4 to 6 is considered a TI RAD 4. TI RAD 4 meaning moderately suspected to be malignant, and these nodules which looks like smooth margins and there are no calcification and the shape is a rounded shape. So however, due to the TI RADS making it moderately suspicious, the fine needle aspirations or follow-up should be recommended according to the size of the nodule. Case 3, this nodule and also do TI RADS according to the 5 categories. Actually, there are 2 nodules here, and these nodules can be described, and taking each one can take TI RADS. The compositions of each of them is solid, so it will take 2. The echogenicity of them is similar to the echogenicity of the thyroid gland, so it will take 1 as an isoechoic description of the echogenicity. There are no taller than wide, so it will take 0 according to the shape. The margin of the nodule is the margins, if you look in this arrow, the capsule of the thyroid gland here, and there are part is beyond to the capsule, so it is invading the capsule and consider the extra thyroid extension, and extra thyroid extension in the margins taking score 3. Echogenic foci, there are calcifications as we see in both nodules, and these calcifications is marginal calcifications or peripheral rim calcification, so it will take score 2. So according to the 5 categories, you can submit all the scores. 2 plus 1, 3, 3, 6 plus 2 is 8. So the final score is 8. And the final score is 8 is considered TI RAD 5, because TI RAD 5 is starting from 7 plus. And this TI RAD 5 is highly suspected to malignant. If you look closely to that case also, there are enlarged lymph nodes at the regional place of the thyroid gland. So all these features making the possibility of malignancy of high, and the fine needle aspirations should be considered because the nodule is more than 1 centimeter, and also after fine needle is confirmed to be calcified papillary thyroid carcinoma. So the TI RADS can help in the differentiating suspected malignant nodules in the thyroid gland rather than benign possibility. And I will give you one case more to do TI RADS yourself, and this is the nodules in the thyroid gland. Can you do the TI RADS for these nodules according to the 5 category? According to the compositions, it is solid nodule, so it will take 2. The echogenicity is similar to the thyroid gland, so it will take 1 iso. Shape is no longer than wider, so it will take 0. And the margin is smooth, also margin, so it will take 0. The calcification, there are multiple small sized calcified foci inside the thyroid nodule, and this calcification size less than 1 millimeter, so it considers a microcalcification or punctate calcifications, and it will take score 3. If you submit 2 plus 1 plus 3, it equal 6, and 6 meaning that the nodules is between 4 to 6 is considered TI-RAD 4. TI-RAD 4 meaning moderately suspicious to be malignant, and moderately suspicious to be malignant meaning if the size like these nodules more than 1.5 centimeter, so fine needle aspiration should be considered. And also this is we should how to scoring the TI-RADS of the thyroid nodule. At the end, I have one more slides. This slide is tips of and hints. There are 6 tips and hints from my presentation today. The first one, I wanted to describe or define the spongy form composition. The spongy form composition, the meaning composed predominantly more than 50% of small cystic spaces. No further points are added for other categories if the nodules is spongiform. The other tips from my presentation today, very hypoechoic echogenicity. As a description of echogenicity can be done by comparing the nodules with the normal muscle. If it is more hypoechoic than the normal muscle, so it considers very hypoechoic, but because this echogenicity taking a score 3 according to the echogenicity. However, spongiform taking a score 0 and no more, no further points needed to be added if the nodules is spongiform. The third tips from my presentation today is FNA. FNA no more than 2 nodules with the highest TI-RADS points scores at the time. And the fourth points is according to the calcifications, as I will describe through my presentation. Macrocalcification is calcifications more than 1 millimeter. However, microcalcifications, which is described as a punctate calcifications, is calcifications less than 1 millimeter in diameter. The last 2 tips and hints about the follow-up. The follow-up more than 4 nodules with no more than 4 nodules with the highest TI-RADS points scores at the time, so don't need to make follow-up to more than 4 nodules. And the follow-up, how to do the follow-up or recommendation of timing of follow-up according to the TI-RADS. If it is TI-RADS 3, the follow-up is 1, 3 and 5 years. If TI-RADS 4, 1, 2, 3, 5 years. TI-RADS 5, 1, 2, 3, 4, 5 years. And this is the recommendations according to the ACR. At the end, I hope I provide you with clear knowledge about the basic scoring or how to make scoring of the TI-RADS. At the end, thank you very much for your watching and have a nice day.